Good morning, everyone. My name is Captain Casey Barton Behravesh, and I'm the director of the One Health Office at the U.S. Centers for Disease Control and Prevention, or CDC. I'm one of the co-chairs for this workshop, along with Dr. Jana Mazet with the University of California, Davis One Health Institute. Thank you for joining us today for this virtual workshop on systematizing the One Health approach in preparedness and response efforts for infectious disease outbreaks. This event's been organized by the National Academies of Sciences, Engineering, and Medicine's Forum on Microbial Threats, with the goal of examining ways to systemize and integrate the One Health approach as part of outbreak prevention, detection, preparedness, and response efforts. I'd like to acknowledge the leadership of the forum with Dr. Peter Daszak as the chair and Dr. Kent Kester and Dr. Rima Kabaz as vice chairs. Also, many thanks go to forum staff, including Julie Pavlin, Charlie Minicucci, and Julie Lau, all three who worked tirelessly to help organize this workshop. Thank you. The Forum on Microbial Threats was created in 1996 to provide a structured opportunity for discussion and scrutiny of critical and possibly contentious scientific and policy issues related to research on and the prevention, detection, surveillance, and responses to emerging and re-emerging infectious diseases in people, plants, and animals, as well as the microbiome and health and disease. The forum has covered a wide range of topics over the years, such as exploring the frontiers of innovation, including diagnostics, vaccines, and antimicrobials to tackle microbial threats, the growing understanding of how the interplay between people and microbes affects host physiology and causes non-communicable diseases, and examine lessons learned from influenza pandemics and other major outbreaks and how they could be applied further to ensure that countries are sufficiently ready for future pandemics. Before we talk more about the objectives and goals of the workshop, I'd like to give some context about why the One Health approach is a critical component of preparing for and responding to infectious disease outbreaks. Fundamentally, the One Health approach recognizes that the health of people is connected to the health of animals, plants, and our shared environment. One Health is a collaborative, multi-sectoral, and transdisciplinary approach with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. And it's important to note that One Health applies at the local, regional, national, and global levels. One Health issues are diverse and include zoonotic diseases, which spread between animals and people, emerging infectious diseases like COVID-19, antimicrobial resistance, food safety and food security, vector-borne diseases, wildlife diseases, and other shared health threats. Even the fields of chronic disease, mental health, injury, occupational health, and non-communicable diseases have benefited from a One Health approach. One Health has gained momentum in every region across the world over the past decade. This includes in the United States as well. This momentum is in part driven by public health emergencies like Ebola and COVID-19. There are some global health initiatives like the World Health Organization's International Health Regulations and the World Organization for Animal Health, or OIE's Performance of Veterinary Services, that have also helped to increase awareness about the critical need for a One Health approach. One Health is increasingly recognized by governments, the private sector, non-governmental organizations, academic partners, and many others as an effective way to combat health threats that affect people, animals, plants, and our shared environment. Effective preparedness and response to these shared health threats requires a One Health approach with an emphasis on multi-sectoral collaboration and interdisciplinary partnerships. No single person, sector, or organization can address issues at the human-animal-plant environment interface alone, and One Health is truly a team sport. Collaboration, communication, and coordination across all relevant sectors and disciplines allows for effective planning and implementation of responses to zoonotic and infectious disease threats at all levels. Indeed, One Health is an important component of advancing global health security and of the Global Health Security Agenda, which is a global effort to strengthen the world's ability to prevent, detect, and respond to infectious disease threats. We know that emerging and endemic zoonotic diseases pose a threat not only to the health of animals and people, but also to global health security. Scientists estimate that 6 in 10 known infectious diseases and 3 in 4 new or emerging infectious diseases are zoonotic in origin. And the ongoing COVID-19 pandemic has really highlighted the importance of One Health coordination, collaboration, and communication during a pandemic response. By working through a One Health approach, all relevant sectors can coordinate, implement, and promote policies and practices that support the prevention, detection, and response to infectious disease threats in people, animals, and plants, and that impact our environments. In my role as the director of the One Health office at CDC, I've seen the impact that One Health collaboration can have in strengthening health systems and improving global health security, as well as maximizing health outcomes for all. And I'm very optimistic about the future. I'd like to take a moment to highlight 2 other interdisciplinary approaches to protecting the health of humans, animals, and the planet. These are EcoHealth and Planetary Health, both of which share similarities with One Health. They all recognize that people and other animals share this planet and its environmental challenges, the risk of infectious diseases, as well as other aspects of health. EcoHealth has been described as involving the health of humans, animals, and ecosystems, including environmental sustainability and socioeconomic stability. Its focus on biodiversity includes all living creatures. Planetary Health focuses on characterizing the human health impacts of human-caused disruptions of Earth's natural systems. This approach emphasizes the health of living and future human generations and seeks to promote equity in health, as well as the sustainability of natural resources and biodiversity. So you can see how these important initiatives relate to each other. Next slide, please. On behalf of the Forum of Microbial Threats, I would also like to thank our wonderful sponsors listed here for making intellectual and financial contributions to the Forum's work. I'd also like to offer my sincere thanks to all the workshop speakers and discussants who are taking time out of their extremely busy schedules to share their expertise with us. And I'd like to thank the National Academies of Sciences, Engineering, and Medicine's Forum on Microbial Threats for organizing this important event. Next slide. Let's look at an overview of this workshop. Today kicks off a 3-day workshop on integrating a One Health approach into outbreak preparedness and response. The goals of this workshop are to discuss strategies to systematize One Health approaches for public health efforts, success and remaining gaps in current One Health efforts, framework of cross-sector collaborations, priority actions for policy change, and the important role of public-private partnerships. This webinar will be recorded and videos of the presentations will be archived on the forum's website. You can also engage with us on social media and join the workshop conversations by using #microbialthreats. Next slide. On behalf of myself and my co-chair, Dr. Mazet, we would like to also sincerely thank the planning committee who's been organizing this workshop over the past 3 months. My hope is that all of our participants will have a fuller understanding of what's needed to integrate the One Health approach into outbreak prevention, detection, preparedness, and response efforts. One Health is truly a team sport, and partnerships are a critical component of addressing barriers and challenges in the One Health space. Next slide, please. I also want to suggest that you save the date. On March 17th, the forum will be hosting a workshop called Moving Past COVID-19, Lessons Learned from Responses Around the World. So today's session will include a keynote presentation that will touch on some of the key messages that will be discussed throughout the next 3 days. Please go ahead and share your slide, Dr. Gooseby, and note that the presence of the Q&A box located along the bottom edge of the live video window, and please submit questions during the presentation. Also note that this Q&A box will be inaccessible when your video is viewed in full screen.